شلونكم يا شباب؟ This is lecture 6 in periodontics. And now we're talking about the dental calculus. The previous two lectures talking about the dental plaque and how to form it and its composition. After formation of the dental plaque, now we're talking the formation of the dental calculus. This is the first definition of the dental calculus is the calcification deposition that forms on the teeth and other solid structure in the oral cavity. Calculus consists of mineralization of dental plaque. It is covered on the external surface by non-mineralized plaque. Calculus represents a predisposing factor for plaque accumulation. It is either supragingival calculus when it's located coronary to the gingival margin, the visible clinical crown, or subgingival when the calculus is present apically to the gingival margin in the gingival calculus or periodontal bones. Clinical appearance and distribution of the calculus. Supragingival calculus is white yellowish deposition, usually represent along the gingival margin of the teeth. However, the color which may be changed to brown due to secondary stain from the tobacco and food pigmentation. This distribution of the supragingival calculus does not follow the supragingival dental plaque. The largest amount of the largest amount are found near the opening of the salivary gland duct. So the calculus is found in the buccal surface of the upper molars near the opening of the parotid gland and on the lingual surface of the lower anterior teeth near the opening of the ducts of the sublingual and submandibular glands. Subgingival calculus is brown to grayish black in color, and it's located between the rest of the marginal gingiva. Detection of the subgingival calculus require careful examination with the exedural. It's usually firmly attached to the tooth surface. The supragingival calculus and subgingival calculus generally occur together, but may not be represented without the other. The primary effect of the calculus is not due to mechanical irritation, as was originally true, but is related to its always being covered by the bacteria and play the major role in maintain and accentuate the dental plaque disease. The periodontal disease by keeping the plaque in close contact with the gingival tissue and create the area where the plaque removal is impossible. Composition of the calculus, inorganic content. The supragingival calculus consists of inorganic 70% to 90% and organic component. The inorganic portion consists of mainly of calcium phosphate and calcium carbonate, trace magnesium phosphate, and the metal and other metals. At least 2/3 of the inorganic component is a crystalline structure. The crystalline form of the percentage are hydroxyapatite, approximately 58%, magnesium waterlock, approximately 21%, octapium phosphate, approximately 21%, approximately 9%. Generally, two or more crystal form occur calculus sample with hydroxyapatite and octasium phosphate begin the most common. Brochate is more common in the mandibular anterior region, and magnesium located in the posterior area. Organic content of the calculus consists of mixture of the following protein polysaccharide complexes, desiccated epithelium, and leukocytes, various types of the microorganism. 2% to 9% of organic component is carbonated, which is derived from the saliva. Saliva protein account from about 6% to 8% of the organic component of the calculus. Lipid content for 0.2% of the organic content of the calculus. Difference between the composition of the subgingival and the supragingival calculus. The composition of the subgingival calculus is smaller to that of the supragingival calculus with other differences. It has the same hydroxyapatite content, more magnesium white lockets, and less brochettes, and octacalcium phosphate. The ratio of the calcium to phosphate is higher subgingival, and the sodium content increase with the depth of the periodontal pocket. The saliva protein represent the supragingival calculus and not found subgingival. Attachment of the calculus to the tooth surface. There are four modes of the attachment of the calculus to the tooth surface. Number one, attachment by means of organic pellicle, which is also calcified. Number two, penetration of the calculus bacteria into cementum. Number three, mechanical looking into the surface of irregularity, such as resorption, lacunae, and caries. Number four, close adaptation of the calculus, understanding depression to the gently sloped amount of the cementum surface. Formation of the calculus. The soft plaque is hardening by precipitation